Hi, Assalamualaikum. My name is SUHAILI binti Jamin, and I'm also a student who are taking research methodology in sport and behavior science for SRT603 and SRB 5A. And my ID student 2016590083. And of course, I'm prepared this my presentation to Madam Wahida binti Tumijan, and I would like to share to you guys that I have choice comparison on passive knee treatment between traditional and modern medicine used among youth and generation. Alright, now we go to the next page. Alright, background of the study. Nowadays, so many level of generation, either youth and all generation have the knee problem. That's why, based on my take some research article that found OA is defined as the progressive deterioration of auricular cartilage, followed by inflammation in the synovial cavity due to extreme pain in the joint caused by OA. Patients experience significant disability in daily living. In the same time, Juan C. M. P. Yanisel C.A. for 2018 found osteoarthritis is the most common form of arthritis and one of the leading causes of disability. And Kate S.D. for 2012 that found the knee problem have diverse of signs and symptoms. For instance, hand, hip, shoulder, foot pain, and also for knee. I was chosen for knee problem as my research title because first I want to more understand indeed about knee to fulfill my career as a consultant specialist in osteoarthritis. In the same time, for the second reason, I want to more improve my skill qualities and understand when celebrate with team and handle patient through modern medicine, and at the same time use the traditional way too. Actually, this is to improve and release their pain, especially for knee part. At the same time, because of my mother and my mother-in-law also have osteoarthritis since 10 years ago. Alright, for the next, osteoarthritis disease also too difficult to find the proper cure, even though this disease was known for a long time before. And for this, I also refer to article from Hacker and by Abid and Hazi for 2020 for the title Pathophysiological Perspective of Osteoarthritis for the volume 1 and for the page 1 until 13. In the same time, I also refer to KSMD for 2012 osteoarthritis for diagnosis and treatment for the volume 1 and the page 49 until 56. Next, Juan C. M. P. Yanisel C.A. for 2018 knee osteoarthritis for the title for knee arthritis pathophysiology and current treatment modalities for the volume 1 for the page 2180 until 2196. Alright, now we go to the next slide, statement of the problem. Okay, what is the most problem when I refer to Muhammad R.S. Dadang R. Widayanto for 2014 that found based on WHO 40% people who age 70 years old and above will get the osteoarthritis. But that totally different when referred in Malaysia from Chai and F. Arumukum M. Lekar R. Munsan L. Sharina M.S. and Subaida J.O. for 2017 that found the knee problem to be 10% to 20% of the elderly population. And the knee pain problem in Malaysia were more common in adult age 40 years and above, affected the Indian ethnicity the most. The community-oriented program for the control of rheumatic disease, COPD, study conducted in Malaysia reported that 64.8% of joint complaints were regarding knee, out of the which more than half with knee pain showed clinical symptoms of OA. Besides this, there were 23% of patients over years who complained of pain, and the figure increased to 39% in those over 65 years old. And additionally, from Jackson et al. For 2001, divide the course of AKP broadly into two groups. For the first group, they include focal lesion, which that can identify clinically or radiologically, and is described as 188 pain in perspective distance. This includes Overus syndrome, trauma, related lesion, dysplasia, tumor, and iatrogenic lesion. For the second group, it's described as obscure and include type of knee pain that are dynamic or are more difficult to define. Alright, for this is what I refer from Muhammad R.S. Dadang, Widianto for 2014. For the title Characteristic Patient Arthritis Lutut Primer di Politeknik Ortopedi Rumah Sakit Al-Ihsan Bandung tahun 2014, Volume 2, for the page 501 until 511. And the same time for Chai and F. Arumugam M. Lekraj R. Munsan L. Serena M.S. and Zubaida J.O. for 2017, Knee Pain and Functioning Disability of Knee Osteoarthritis Patient seen at Malaysian Government Hospital for the Volume 2, for the page 7 until 15. Alright, let's go. We go to research objective. Okay, for this we have three objectives. For the first, to identify the effect when used the traditional and modern medicine among knee patients. And then for the second, to identify the level of qualities of treatment among patients. And the third, to investigate the method that used in traditional and modern treatment can treat well the pain, or it just to relieve with or without side effects. Now we go to the next page, to significance of this study. Okay, to significance of this study, I will for this study focus to Ministry of Health, which to finding of the research will be guideline for the Ministry of Health to plan a proper program or support among the young and old generation. And second, for the patient, the finding will become a fundamental knowledge for the patient in identifying the osteoarthritis problem of their knee. And for the student, acknowledge the student who has acknowledge student who has a study or get information specialist comparison between traditional and modern medicine are related. Alright, for the literature review. Okay, comparison on perceived knee treatment between traditional and modern medicine used among youth and old generation show the different relief pain on knee. Comparison on these two can see specific to traditional use herbal. Okay, from traditional that use herbal, nutrient supplement, homeopathy, mind-body therapy, body movement, and also for Chinese medical treatment, traditional, we call Duhua Jishen 1. Okay, for example of the nutrient supplement, I mean for the traditional that's used for the treatment, like vitamin, green leaf mussel, avocado, soybean, and so on. But through traditional treatment also can harm to disease. I mean can make the patient feel to have the problem and can harm for the health. It is because that can abnormal heart rhythm and also for bleeding. And actually this also have the different when using the modern medicine. Through modern medicine also can see specific through simple analgesics and SAIDs, hyaluronic acid injection, glucosamine, biotherapy, pharmacological treatment, weight loss, knee arthroplasty, anesthesia for knee operation. Use the modern medicine through simple analgesic, which combine the paracetamol and ibuprofen. Okay, actually, for the modern, actually it's better because that able to relieve function and quality of life. However, the combination of this also can use for can make the give the impact which the side effect primary GI and also for bleeding to the patient. How long how in the same time the combination of these can use for short and long time use too. Now we go to methodology. Okay, for this part, for this study is non-experimental research using quantitative design. At the same time, the research involves collection and analysis of data by using random surveys. Okay, alright. Now we go to the next, which sampling. Okay, for this, sample profile of the participant in the control and intervention group, which we focus to age range for specific to 35 to 75 years old. And the gender, of course, we random to female and male. For the ethnic, we focus to Malay, Indian, Chinese, and also others than Malay, Indian, Chinese. Okay, for the education level, we focus to primary, secondary, tertiary, and others. For the marital status, single, married, widow or widower, and also divorce. And the type cohabitation, we focus to family, with carer, or alone. And monthly income, we specifically focus below 10,000 until that above than for 4,000 ringgit. This is monthly income. Okay, actually, a population of the study is a kidney pain sample will be taken from two unpaired random control study. Okay, and this study involve kidney OA patient from hospital Jaya and Hospital Sedang, and we also use the formula for the sample study. Alright, and we also use the Fab Fisher exact test and significant at p less than 0.05, and also we use the English and Malay version, that a KOS questionnaire 20 was pre-test and validated. And to be honest, for the total group, for the control group, we have the total is 150. Intervention group also 150. So the randomization was done by applying independently operated computer generated random sequence system with the block. And actually, the randomization of SIG can go to the website HTV random allocation software. Alright, now we go to instrumentation. Okay, for this instrumentation, data on level of knee pain and function disability was obtained using KOS questionnaire. Okay, in this questionnaire also, we also use for the English and Malay version. For KOS questionnaire 20, they was pre-test and validated. And do you know the English version of KOS was validated with Cronbach alpha above 0.721, and also actually it's different with Malay version from the Cronbach alpha range from 0.994 to 0.9622. And of course, permission of using the questionnaire was obtained from others, and KOS questionnaire contain 42 items in 5 separately with scores, conceptual pain, other symptoms, functioning in activity of daily living ADL, function in sport and recreation and kidney related quality of life. However, all the 31 items out of 42 items related to pain. Alright, so we go to the next slide. For ADL and function in sport and recreation were adapted in this study. A national disability health survey in France found that individual with kidney OA compare had and most doublet higher limited in walking and carrying objects. And the result also found the kidney OA mainly affected walking 22%, carrying object 18.6%, and dressing 12.8%. The COP. Actually, the program which was conducted in Malaysia was to examine the nature and range of rheumatic complaint in a multiracial Malaysian population from Malaysia, Malay, Indian, Chinese in a similar area. Result found that the most significant disability phase was not being able to squat. Alright, now we go to data collection procedure, which data collected were analyzed using SPSS version, and then exploratory data analysis was performed. This because to detect any outlier, missing value, and assumption checking on data normality, equality of variance, and multicollinearity. Descriptive statistics include mean and standard deviation were used to describe continuous data, and percentage were used to describe categorical data in this study. Besides, G-square test was used to compare whether the frequency distribution of participants in both intervention and control group was equal or unequal, and feature exact test FET was referred when the expected frequency for a particular category was less than 5. All significant levels were set at a p value of less than 0.05. Alright guys, now we go to the next point, the next slide, data analysis. Okay, actually the first to complete this research for this mini research, of course, from the article, to get permission from disability of knee OA patient attended orthopedic clinic at Hospital Putrajaya and also Hospital Sedang, Malaysia. Actually, to get permission to ask question to start the questionnaire. And next, after the English version and of KOS was validated with converge alpha above 0.7 to 1, and Malay version with converge alpha range from 0.94 to 0.96 to 2. Okay, and then from the and then from the English and Malay version validate, so we go to KOS questionnaire contained 42 items in 5 separately scored subscale, and then we go to data collected, we analyze using SPSS version, and then after that the study also was approved by the Medical Research Ethical Committee, Ministry of Health Malaysia, NMR 5074, and also from was approved by University Putra Malaysia Ethics Committee for research involving human subject prior to the commencement of the study. Alright, by the way, thank you.